If you're facing a knee replacement, you probably want to know one thing about recovery. When will my knee bend and straighten like it should? Well, here's the honest answer. Good early range of motion is absolutely achievable, and we work on it from day one. But your final range of motion is the long game. For most people, it keeps improving for up to a year. So the goal in these first weeks isn't to force a number, it's to protect the knee, control the swelling, and let the motion come. And every patient's journey is a little different. Yours will be yours. I am Dr. Corey Calendine, an orthopedic surgeon in Franklin, Tennessee. This is my independent clinical perspective, and it's not a substitute for advice from your surgeon. Let me tell you how I think about the order of recovery, because the order matters. Range of motion comes first. Strength comes later. I'm a big believer in that sequence. Early on, I don't want you grinding away at strengthening the knee that's already hot and swollen. First, we calm the knee down. Then we get it moving, bending, and straightening. Once you've got good motion, then we build the strength. And then we get you back to everything that you're trying to return to. Motion first. It's the foundation, and the rest of your recovery is built on it. So, what gets in the way of early motion? Swelling. Swelling is the enemy of the bend. A swollen knee is tight. A tight knee simply won't move. That's why so much of the early pain plan is swelling control. Ice, elevation, especially around the time of surgery and in those first couple of weeks. Get your leg up. Put some cold on it and a barrier so it doesn't burn your skin. When you keep the swelling down, the motion comes easier and the whole thing hurts less. Less swelling, more motion. They go together. Now, I want to tell you about a trap, but it starts with good news. The nerve blocks we use are good. I mean, really good. For a knee, we use an adductor canal block and an IPAC block, plus we put numbing medicine around the joint itself during surgery. That medicine in the adductor canal especially can give you up to 3 days of coverage. So the first day or two, maybe 3, a lot of patients are feeling great, maybe too great. I had a gentleman call me about 48 hours after his knee replacement. He was in his yard trimming his bushes. He was thrilled, but here's the problem. I knew the call was a setup because the swelling hasn't fully arrived yet, and at 48 hours, he might be at trouble down the road. The swelling really settles in around day 3, 4, 5, or 6. That's when the tightness and the soreness show up. And if you spent your pain honeymoon trimming the bushes, you're going to meet that swelling from a much different, worse starting point. This is where I sit a little differently than the old standard line. You've probably heard it. As soon as you can go, go as hard as you can. I don't agree with that, not in the first few weeks after knee replacement. If you take that early pain control from the blocks and you overdo it, you'll be paying for it with swelling. And the more swelling means more pain, less motion, and setbacks that are genuinely demoralizing. There's real interest now in protecting that early window instead of attacking it. Groups studying this are looking hard at elevation and icing and intentionally limiting how much you're on your feet, particularly in the first several days. A crude rule of thumb that I like to give my patients is like 500 steps a day or less in the first week. Now, that's a rough number, not a prescription, and your team should tailor it to you, but the spirit of it is right. Even when you feel good, you don't need to push hard in week 1. Let the swelling stay down. Then the recovery climbs steadily. You don't end up crashing. Again, what you don't want to do is come out of the gate too fast and then take a massive step backwards. That's the frustrating thing a patient goes through if they start too fast. A gentle, even boring first few weeks buys you a much better month. So here's the art, week by week, knowing yours will vary. Day of surgery, you're up and walking the same day. We're already asking the knee to bend and straighten, but gently. Week 1, the hardest week, and the week of swelling. The job here is straightening the knee fully and getting comfortable, controlled bending. Full extension. Getting the knee flat matters as much as the bend. Don't neglect it. Weeks 2 to 6, this is where motion really opens up as the swelling drops. Physical therapy for the knee usually runs around 3 times a week for 6 weeks. Some people need more, some people need less. We push the bend a little harder now because the knee can tolerate it. 6 weeks and beyond, most of your functional range of motion is coming together. And from there, you keep gaining, slowly, for months. Remember, ultimate range of motion can take up to a year. So if you're not exactly where you want to be at week 6, that's not the final story. So how do you know when to push and when to back off? Well, listen to your own leg. Soreness that settles down after you work is normal and fine. Swelling and heat in the knee that keep climbing is the leg telling you that you did too much. That's when you ease back, ice, elevate, and then come back to it. And call your team for the warning signs that aren't about motion at all. A calf that's swollen, red, and painful, a fever, drainage from the incision, or pain that's suddenly worse instead of slowly getting better. That deserves a phone call. So here's the whole thing in one breath. Motion first, then strength. Keep the swelling down with ice and elevation. Don't let a great first day talk you into overdoing it. Respect that swelling that arrives at days 3, 4, 5, and 6. Sure, work on the bend, but also fully straighten the leg. And give your knee up to a year to reach its best. It's okay to start slow, almost insultingly slow, and build from there. If you want to walk through your own recovery, the link for a consultation is in the description, along with my week-by-week recovery guide. In any event, thanks for watching. Hope to see you back here.